From the San Francisco Public Press, you're listening to Civic. Mayor London Breed is facing one of the most pivotal moments of her political career. She's campaigning for re-election amidst a dual crisis of addiction and homelessness. Her solution is to screen welfare recipients for drug dependency and compel them into treatment. Those who decline will have their assistance revoked.
No more handouts without accountability.
Now it's up to voters to decide. And a fierce debate has rippled across San Francisco and beyond.
Reducing benefits and resources increases overdose fatalities.
The idea may sound familiar to people who remember Care Not Cash. Controversial plans to clean up the streets are a long San Francisco tradition. In this episode, we explore past strategies and the implications for Prop F. I'm Sylvie Sturm, and this is Civic.
I want to tell you a little bit about our nonpartisan voter guide that you can find if you go to sfpublicpress.org. We at the Public Press don't do endorsements. We do provide research summaries of all the ballot measures in both text and audio formats that break down what each measure is really about. We also have information about who supports and who opposes each measure. We include candidate bios for all the candidates running to represent San Francisco in local and state government positions. We sent each candidate a question about how they would address specific issues in San Francisco, and you can hear what they had to say. Just go to sfpublicpress.org to check out the March 2024 SF Election Guide. sfpublicpress.org. You're listening to KSFP-LP, San Francisco, 102.5 FM.
I've been in San Francisco for nearly 10 years, so long enough to know that its infamous reputation as a progressive city is based on politics that have an ebb and a flow. And those politics appear to sync up with public interest in funding social services. Mayor London Breed faces a re-election that could make or break the rest of her political career. And the city's struggle with homelessness and a fatal drug epidemic has only gotten worse during her 5.5 years as leader. So she's leaning into a plan to coerce unhoused people with substance use disorder into treatment, even though it contradicts the advice of the Department of Public Health's overdose prevention plan. Last fall, Breed announced a plan to compel single adults enrolled in the County Adult Assistance Program to be screened for a drug dependency before they could get their cash benefits.
No more anything goes without accountability. No more handouts without accountability. So in order to get resources from our city, you will need to be in a substance use disorder program and consistently seeking treatment.
Anyone who's flagged as having a substance use disorder would have to enter some form of treatment to get their benefits. People who decline either screening or treatment would be denied cash. Instead, they'd get 30 days of shelter access or rent paid directly to a landlord, with a possible extension. Breed proposed the plan as a measure in this March's election. It's called Proposition F. Illegal substance dependence screening and treatment for recipients of city public assistance. And it's a serious departure from the harm reduction philosophy at the heart of the San Francisco Public Health Department's overdose prevention plan. Harm reduction encourages people to recover incrementally towards healthier behaviors in a non-judgmental environment. It recognizes that complete abstinence from drug use isn't the only way to survive a substance use disorder. Programs prioritize resources and services like healthcare, mental health, housing, and job training. They also include handing out opioid overdose reversal kits and clean needles to help prevent the spread of HIV and hepatitis C. A coalition of more than 24 community groups responded to Breed's announcement by launching a No on F campaign. In a November 30th letter addressed to the mayor and board of supervisors, they wrote that the measure would worsen homelessness, contribute to stigma, and cause disruptions in treatment services and accessibility. They said that the measure is especially perilous to the health and stability of Black, Latinx, Indigenous, and low-income people. A Human Services Agency demographic breakdown shows that nearly half of welfare recipients' race are unknown, But of the races listed, the largest representation is Black, despite being only 6% of the city's population. On February 2nd, community organizers and addiction specialists held a press conference. Here's Laura Thomas, Senior Director of HIV and Harm Reduction Policy at the San Francisco AIDS Foundation.
We know, and the data is clear, and the medical and public health research shows that reducing benefits and resources increases overdose fatalities. The San Francisco AIDS Foundation is, among other things, a state-licensed substance use disorder treatment program. We are taking a position of no on F based in our extensive experience. F is a cynical and unserious waste of resources that will materially harm very vulnerable people, increase homelessness in San Francisco, and it does not in any way increase access to needed substance use disorder treatment. And I want to be clear, we know how to connect people to treatment. We know what works. We do it every day at the San Francisco AIDS Foundation. The staff on our harm reduction and syringe access services team connect hundreds of people to treatment every month. We provide low-threshold substance use disorder treatment programs through our Stonewall program and our PROP program, and we bring hundreds of people in and connect them to the level of care that they need and are able to work with people to step up to more intensive level of services. And we are very proud to be the path to recovery for many, many people every year. And yet, we are facing reduced funding for our lowest threshold programs. We do not currently have funding for the medication-assisted treatment linkage program, and we only have doctors from the city on site a few hours a week to be able to link people to buprenorphine. Those are all things that we know that work and that we can be expanding as the city. And for example, if the Human Services Agency wants to connect people to treatment, I highly recommend that instead of putting this wasteful and cynical initiative on the ballot, that they add a couple of linkage counselors to connect people to medications for opioid use disorder, including buprenorphine and methadone.
Advocates say that to be successful, harm reduction must include enough residential treatment beds to meet demand and safe consumption drop-in facilities, among other programs. That's also included in the city's overdose prevention plan, but those goals have never fully been realized. Nevertheless, an emerging faction of political groups with names like Progress SF, Neighbors for a Better San Francisco, Grow SF, and Together SF say that it's time to give up these ideals and take a more heavy-handed approach towards substance use disorder. Some of them have put a lot of money into campaigns that are redefining harm reduction as devoid of recovery treatment, like this one from Together SF.
The city's approach so far has been to focus on harm reduction instead of abstinence or recovery. That's because it's our cultural priority to avoid stigmatizing a drug user, and that's a good thing. But it's not okay to let people suffer in their addiction.
Last May, Bree came to the same conclusion. She approved a plan to arrest people appearing intoxicated in the Tenderloin neighborhood as a means of encouraging them to enter treatment. According to Diane Goldstein, that's a mistake that city leaders persistently make. She's a retired police lieutenant from Redondo Beach and now the executive director of the Law Enforcement Action Partnership, also known as LEAP. That's a group of police, prosecutors, judges, and other criminal justice professionals focused on drug policy and criminal justice.
Legislators and county board of supervisors and city councils don't adequately fund programs that are more efficacious in the prevention of public health issues, public safety issues, mental health issues. They wait till things are so bad. And then they call the cops to fix the problem with the wrong set of tools. And frankly, I just don't know if the public is ever going to understand it, because they don't understand that law enforcement should have never been tasked with enforcing a public health issue going back years. But the reason we do is we're the only people that answer the phone in the middle of the night.
Breed's police crackdown didn't improve the overdose death rate in San Francisco, 2023 became the deadliest year on record for overdoses, and 911 was inundated with overdose-related calls, 200 more calls in just the last 4 months of 2023 compared to the previous year. Meanwhile, all those arrests didn't succeed in enrolling people into treatment. So last September, Breed introduced the idea of withholding cash assistance if people decline to be screened for drug dependency.
The arrests that we're making for public intoxication, people are not accepting help. And so now it's time to make sure that we are cutting off resources that continue to allow this behavior to occur without the accountability, without someone involved in a treatment program that could lead to a better life. It's time for us to get serious with treatment and with support for those suffering from addiction in light of what has happened with a number of people who are dying.
Trent Rohr is the city's social services agency executive director. He joined Breed in announcing the plan. He said they're targeting people who collect these benefits because a high percentage of them suffer from substance use disorder.
About 20% of individuals who receive county adult assistance have self-declared that they have a substance use disorder. Now, this is a self-declaration, and those in the field will agree with me that generally a self-declaration is an undercount or underrepresentation of those who actually suffer from substance use disorder or addiction. The second data point, the Department of Homelessness and Supportive Housing did a survey in 2022, along with their homeless count, where 52% of homeless individuals surveyed self-disclosed that they had a substance use disorder that they considered a disabling condition. The third data point, the medical examiner's office did a report from 2020 to 2022 that showed that 25% of overdose deaths during that period were people who had no fixed address. In other words, they were homeless. The data is clear. This is a population that disproportionately suffers from substance use disorder. It's a population that is not availing themselves of treatment.
That last statement left me wondering, how does he know that all these people hadn't availed themselves of some form of treatment? A harm reduction center, medical assistance, or even an AA meeting? After all, recovery isn't a linear process. I spoke to Brandon Del Pozo, an assistant professor of medicine and public health at Brown University. He had the same issue. For the last few years, he's been conducting research on the drug crisis and its intersection with policing and criminal justice. Prior to that, he spent 19 years in the New York City Police Department. He was then the chief of police in Burlington, Vermont, where he organized the city's response to the opioid crisis.
This approach does not account for the fact that addiction is inherently a relapsing remitting disease. The clinical odds of someone getting on the medication and staying on the medication are very low without repeated attempts. The cop in me says if you could get them to stay on for 5 years and that's the facts, try it. That is just not the world. It's just not true. People will fail out of this and lose their assistance, lose what they need to survive.
Supervisor Matt Dorsey initially sponsored Prop F as legislation for a board vote, but the majority of supervisors were against the idea. Board President Aaron Peskin was especially dubious about how much it would cost to undertake such a massive program. In a written statement, he said, quote, "If she can't find a way to prevent several hundred brazen criminals from selling deadly drugs, how does she think she'll find the resources to drug test thousands of welfare recipients?" End quote. According to an analysis by the city controller, the measure would have a moderate impact on the cost of government. The annual cost of administering the program is estimated at between $500,000 and $1.4 million. That would be partially offset by discontinued assistance from people who decline to be tested. That savings is estimated at anywhere between $200,000 and $4 million in the first year. Subsequent years would see savings of about $100,000 to $2 million. What's not accounted for is the cost of additional withdrawal management services, residential treatment beds, and step-down programs needed to accommodate potential new enrollments. For context, the city spends about $12,000 per person for a 90-day treatment stay. If everyone who reportedly suffered from a drug dependency agreed to enroll in a program, it could cost the city $12.5 million a year. Breed wouldn't be dissuaded by the supervisor's disapproval. Since they weren't going to support legislation, she put it to the voters. If more than 50% vote in favor, housed people on assistance would have to submit to screening and, if necessary, treatment, or else lose $700 a month. That money would instead go directly to their landlord for 30 days. After that, the measure states they could get an extension. If they're unhoused, they could lose just over $100 a month. They would instead be offered a guaranteed shelter bed for 30 days. Those monthly sums sounded a bit confusing to me at first. Why give someone without housing $100 and give someone with housing $700? I found out that this arrangement came about more than 20 years ago thanks to a welfare reform measure introduced by then Supervisor Gavin Newsom called Care Not Cash. It was 2002. Homelessness was at an all-time high. San Francisco had more than 8,600 residents without homes, and more than half of them were unsheltered on any given night. It was a mess long in the making, and it wasn't helped by previous leaders' solutions. Like a decade earlier, Mayor Frank Jordan launched an aggressive stance on physically removing unhoused people from city streets through a policy he called Project Matrix. A former police officer, Jordan was elected on protecting business interests, arresting aggressive panhandlers, and sweeping homeless encampments. People were removed from city parks and sidewalks through vigorous enforcement of quality of life ordinances that banned loitering, vagrancy, public drunkenness, and other, quote, suspicious activity. Meanwhile, the city didn't increase services to help residents escape the cycle of poverty and arrest. By 1995, it was clear that Jordan's plan was a failure. His successor, Willie Brown, called the strategy, quote, persons in uniform operating as if they are occupational officers in a conquered land. But it didn't take long for Brown's policies to resemble Jordan's. He committed hundreds of thousands of dollars to the city attorney and district attorney's offices to prosecute aggressive panhandlers, public nuisance violators, and vagrants, but didn't provide additional funding to homeless services. By the late 1990s, things were bleak for unhoused people in San Francisco. They were de facto criminals, but literally had no place to go because of shelter shortages. The homeless population was estimated at anywhere between 7,000 and 16,000. Meanwhile, shelters could only accommodate 2,000 people. So this was the context in which Newsom introduced Care Not Cash. And looking back, the parallels with Prop F are stark. Newsom's plan was to cut nearly all the money given to unhoused people to prevent them from buying drugs and alcohol, and to strongly encourage them into shelters. He initially introduced it as legislation to the Board of Supervisors, but the majority of supervisors didn't support it. So he put it to the voters as a ballot measure in the 2002 election. The campaign for Care Not Cash ignored much of the context for the homelessness crisis. It didn't focus on past blunders or misallocation of funds. It also ignored the economic impact of the dot-com boom, which had caused rents to soar and evictions to spike. Instead, Newsom and other city officials relied on vilifying welfare recipients. TV ads for the ballot measure supported the narrative by showing a series of bedraggled men speaking directly into the camera.
I took your cash and I bought drugs.
Crack.
Heroin.
Alcohol. I took your cash and bought cigarettes. Beer.
I take your cash and snort it up.
Seeing this ad from 20 years ago reminded me of an ad that aired last fall by Together SF. That's one of those political lobby groups I mentioned earlier. The ad features Cedric Akbar. He's co-founder of an organization that provides formerly incarcerated people with rehab and mental health services. Akbar denounces harm reduction services because he believes it would have enabled his addiction to heroin.
If I had the opportunity to be able to get free needles, foil paper for free from the city, and also have the city pay for my drugs with my GA money, then why would I stop using drugs?
He went into greater detail about his journey into recovery during a public meeting at the Sheriff Oversight Board in early February.
When I found the Brothers in Positive Directions, it finally clicked on me that I needed to be held accountable, because if I leave myself to my own wishes, I will do what I want to do. And once I found that out, and I found out that I had to constantly check in with other people, that's when the light came on for me.
Akbar is part of a slate of 24 candidates vying to oust incumbents from San Francisco's Democratic County Central Committee, or the DCCC. That's a powerful governing body of the local Democratic Party. It hands out key party endorsements during election season, and it's come out against Prop F. During the Care Not Cash campaign, Newsom and other city officials also claim that the street population was increasing because out-of-towners were coming to get public assistance. And that reminded me of recent claims by Supervisor Matt Dorsey about people who use drugs coming into the city to take advantage of San Francisco's social services.
It's also resulting in a level of drug tourism, or San Francisco becoming a destination city for drug use. And I think that's actually hampering our ability to do as good a job as we could for people who are unsheltered and homeless.
Dorsey's also running on that DCCC slate that's trying to oust incumbents. He made that claim about drug tourism after Police Chief Bill Scott told the Police Commission last June that during 2 weeks of a police crackdown in the Tenderloin,
of those 45 people that this task force, our officers, have arrested, only 3 claim to be San Francisco residents. The majority of the people that we are coming in contact with, at least as far as arresting, when we ask and try to determine where they actually live, they don't live here.
After some pushback on his claim, last month Dorsey asked the city's controller to come up with data to determine whether San Francisco really has become a drug tourism destination. A report hasn't been presented yet. In the meantime, I analyzed SFPD arrest logs from the Tenderloin and South of Market police stations from March to December last year. The arrest logs showed that about a third of people had a local address. A quarter were listed as transient, meaning unhoused in San Francisco, and a third didn't have a local address. The remaining address information was left blank or blacked out. Of people booked into San Francisco County Jail on drug-related charges from January to November last year, 70% were local. Only 15% were from outside of San Francisco. The rest were of unknown address or unhoused. And 90% of people who died of accidental drug overdose last year were local, according to the San Francisco Chief Medical Examiner. Back to Care Not Cash. It passed handily with 60% voter approval. So cash benefits for the unhoused went from $410 to $59 per month. In exchange, enrollees got food vouchers and a bed in a shelter or in supportive housing in a single-room occupancy hotel. Opponents said the measure would do nothing to help ease homelessness since it created no new housing for low-income residents. But it would take away a means of buying essentials and drive more people to commit petty crimes or panhandle for cash. But Newsom quickly answered that problem. In 2003, he sponsored Prop M, which took aim at aggressive panhandling. Offenders could be fined or, if they qualified, attend a diversion program for substance abuse and mental health disorders. Prop M was also presented as a way of helping people, as seen in a series of dramatic ad campaigns.
1 in 4 ambulance trips is paramedics picking up street drug abusers.
There's nothing compassionate about our panhandling laws. Some days 1/3 of our beds are filled with people sick from drugs and alcohol.
The price of failure is very high. Last year, 169 homeless people died in San Francisco.
The city reported that more than 2,000 people were housed over the following 3 years. Since then, homelessness has grown incrementally. It went from 6,200 to a high of just over 8,000 in 2019. The last reported count, held in 2022, tallied a little more than 7,700 people experiencing homelessness. In an article for KQED's The California Report published 4 years ago, Rohr, the head of San Francisco's Human Services Agency, said that Care Not Cash was never about ending homelessness. It was about welfare reform. And as a welfare reform measure, it was a huge success. After 3.5 years, the number of unhoused people on monthly assistance plummeted from more than 2,400 to 545. Cutting those cash payments allowed the city to save $13 million a year, and that money went towards supportive housing, according to a 2003-2004 city budget report. But access to beds, either in a shelter or in a hotel, never became a guarantee, and it still isn't. In fact, a lack of accessible shelter beds is the reason why courts are still limiting the city's ability to sweep homeless encampments off the streets to this day. There's no doubt about one thing, Care Not Cash was a professional win for Newsom. He made national headlines with this ballot measure. That popularity followed him through his mayoral campaign a few months later, and that catapulted his career into state leadership. Looking at the parallels between Prop F and Care Not Cash, I couldn't help wondering whether Breed is looking to mirror Newsom's success. Prop F has the backing of some super wealthy donors in the tech sector. Tech CEO Mark Pincus donated $25,000. He's also donated to one of those new lobby groups, Grow SF, and a raft of other local political causes, including recalling the district attorney, Chesaboudin. Tech investor Ashish Birla gave $25,000 to Prop F as well. He also donated to a recall that shook up the San Francisco School Board a few years ago, and he's on the board of the peer-to-peer lending firm Ripple. Which brings us to Chris Larson. Larson is a tech billionaire best known for co-founding Ripple. He's one of the richest men in the world and a major donor to political groups, Neighbors for a Better San Francisco, Progress SF, and Grow SF. He spent nearly $1 million on this election so far, including $250,000 on Prop F and donations to various DCCC candidates to replace progressives. In our last episode of Civic, our publisher Lila LaHood covered the upcoming election of San Francisco Superior Court judges. As Lila mentions, Larson also donated $100,000 to unseat an incumbent in this race as well. He's also a huge champion of Breed's. Here he is speaking on Bloomberg News.
You've got a board of supervisors that doesn't work with the mayor. That's a huge problem. And unfortunately, that can only be addressed in the 24 election. And there's a lot of people focusing on that, including, we're focused on that. We hope we can change that and get a board that works with the mayor.
There are also some influential people who don't support Breed's policy. Things have changed over the past few decades that make her ideas seem a bit regressive, even for people who may support coercive treatment. Keith Humphreys, Stanford professor of psychiatry and behavioral sciences, has talked publicly about his belief that San Francisco has been too permissive in dealing with people with substance use disorder. That led some people campaigning for Prop F to think they had an ally in Humphreys. They were wrong.
And I read it carefully. It was sent to me by someone in politics in San Francisco asking me, do I want to endorse this? And the answer is no. And this is why. What is the case for sending people on general assistance, forcing them into treatment? Being poor is not a crime. If this is something that is important to do, we should be doing it with people who threaten public safety and not people who need this money to eat and pay their rent. So I don't see a case for this at all. If they had a ballot proposition to say from now on when someone with a drug problem actually hurts somebody actively, that would really be different. But that's not what this is. This is just they're poor.
He joins numerous other addiction specialists who condemn the plan. Marlene Martin is an associate professor at UCSF and founding director of the addiction care team at San Francisco General Hospital. She was among 5 medical professionals who gathered during a press conference on February 9th to speak out against Prop F.
My patients share that they use substances because of housing instability, trauma, poverty, discrimination, and untreated mental illness. I wish I could prescribe something that resolves these from one day to the next. However, getting housing, accessing a therapist, finding employment, seeing a doctor, all of these take time and a helping hand. For some, the support of public assistance makes a difference. Proposition F places this in jeopardy. Proposition F threatens the very safety net that keeps people who are on the brink of becoming unhoused housed. It threatens the access to food that may reduce the impacts of substance use on health. It threatens the trust it takes for someone to disclose their substance use without fear. It threatens access for the people seeking addiction treatment today who may not come knocking again tomorrow. I have seen addiction and overdose worsen when people lose support systems, and that is what Proposition F threatens to do.
In the decades since Care Not Cash, numerous studies have shown that forcible treatment is not successful. But when confronted with these studies, Breed has said
Regardless of what you read or what you see in a particular report, which is an overall view of what's happening, the fact is it's not just services. It's also force.
Lisa DeGard gets it.
The problem that we've got is that public officials under public pressure need something to point to that seems like action.
DeGard is the co-executive director of Purpose Dignity Action, formerly known as the Public Defender Association. DeGard said that we can no longer ignore the fact that coercing people into drug treatment is counterproductive.
The recovery journey is not what people think it is, and whether people enter it voluntarily or are ordered into it, classical, old-style drug treatment that is focused on the use of the drug without tackling the surrounding circumstances fails almost all the time. And there's new research, I think is international research, showing the phenomenally high failure rate after 30 days of relapse from residential, classical, Assam-style drug treatment. It comes from an understandable impulse to help people get better, and that is not how people get better. We have to look past that initial step of tell people to go do a thing and imagine what happens if they don't do that thing. So now you have people in an even more miserable situation than they are right now, who definitely are going to be turning to the illicit economy to get their income. And that's not good for anybody. And we know that most people will not complete that requirement. And then even more discouraging, if they did, that also won't result in most people making progress with their drug addiction, because that approach to drug treatment is too narrow and generally fails, at least for the first many times through, and it doesn't solve the surrounding circumstances that often are what drives the drug use. It's kicking the can down the road, setting up a situation where now people are no better off and don't even have a little bit of lawful income that mitigates the risk of their involvement in criminal activity to make a living.
DeGard said a better solution is to implement a program that actually makes a difference, both for people suffering from substance use disorder and for public safety. She pointed to a program called LEAD, or Law Enforcement Assisted Diversion, also known as Let Everyone Advance with Dignity. DeGard's organization launched the program in Seattle in 2011. It brings together law enforcement officers, street teams, case managers, public health clinicians, and justice system professionals to enroll repeat low-level drug offenders into community-based health and social services as an alternative to jail and prosecution. LEAD has been widely replicated across the country, from Honolulu to New Jersey.
How can we persuade public officials to give that a chance? In my opinion, we can't unless their constituents who are calling for improved response get on board with this. So we spend a ton of time making sure that at a retail level, businesses are satisfied with the approach that we're recommending. Police are satisfied with the approach that we're recommending. It works for them. It assists them. It is visibly making the situation better with individuals, visibly making the situation better on the street. And once you get that rolling, that ball rolling, then the message to public officials is like, we got this. Your job is to say yes to this thing that we all agree on, and our job is to implement it and to interrupt that, the current, phenomenon of people taking office, saying they're going to do a thing and then making it up when they're not the experts on recovery. They don't know how people get better. And with that impulse to quick action can be very, very destructive.
San Francisco gave LEAD a chance 7 years ago. The city received a $6 million grant from the Board of State and Community Corrections to run the program from 2017 to 2019. But it stumbled after just 2 years, despite showing significantly lower rates of misdemeanor and felony arrests and felony cases among enrollees. One of the main problems was getting buy-in from law enforcement. That's according to an evaluation by the California State University Long Beach School of Criminology. It was a major shift to go from arresting people to diverting them into social programs, according to interviews with officers and court personnel quoted in the report. As one officer said, quote, "I've been around cops for almost 30 years, and it's not going to be push a button or snap your fingers, and everybody's going to go, okay, we'll do it different," end quote. It's been 5 years since San Francisco abandoned LEAD, but it may not be gone for good. Police Chief Bill Scott expressed his willingness to revisit the program at a police commission meeting last June. It's unclear whether efforts have been launched to revive the program. The SFPD did not respond to our inquiries. I'm Sylvie Sturm, and you've been listening to Civic. Civic comes to you from KSFP LP 102.5 FM in San Francisco. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes producer Leanna Wilcox and contributor Mel Baker, who is also the program director at KSFP. KSFP is a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find our reporting at sfpublicpress.org. Thanks for listening.